Right, I'm Irfan Pasha. I'm an ENT surgeon. I come from Hyderabad in India. I trained there in my MBBS and I became an ENT surgeon with MS training in Hyderabad. Then I moved to the UK in 1998 and I trained again as a ENT surgeon. I finished my old FRCS and the new FRCS with the CCT and became a consultant in Northern Ireland. I became a training program director. And after several years of work, I moved to the Middle East. I worked in Saudi Arabia, in Riyadh, as a consultant in ENT and head of department. Then I moved to the UAE in Sheikh Khalifa Medical City as an ENT surgeon and head of department. And I became also higher in the administrative post as a chair of surgery. I moved to Burjil Medical City. I've been practicing as an ENT surgeon. I'm the director of the Head and Neck Institute. I'm also the chair of surgery. I do ear surgery. I'm an otologist and I deal with both children and adults with various hearing problems. Today, let's talk about Bone Bridge. Bone Bridge is a wonderful device which can give hearing back for people who cannot afford or wear a normal conventional hearing aid. Those of us who lose the hearing can usually wear a hearing aid just like we wear glasses. But however, if the ear canal is not normal, the sound which goes through the air cannot go. There are children who are born with no ear from the outside, or the outside ear looks fine, but the canal which goes inside may not be fully formed. So there are several children where the ear is not developed and who cannot wear a hearing aid. There can also be adults who have a lot of infections in the ears, who had surgeries in the ear, and the ear keeps leaking and getting infected, who cannot wear a hearing aid. In these cases, we can still give them hearing. The ear is a wonderful organ where the sound can completely bypass the outer part and directly can be given to the cochlea, which is the inner part of the ear. And amazingly, they can hear normally. This is like a standard hearing aid, and the hearing is natural sound, but which can be transmitted directly bypassing the outer part of the ear. This is one of the only organs in the body with a sense organ where we can do that. And a bone conduction hearing aid is one of those wonderful devices which can restore these hearing to these people, both children and adults. So the way it is done nowadays is completely implanted under the skin. So the big hearing aid part is fixed into the bone, and the skin on the outside looks absolutely normal. So the whole hearing aids is completely hidden under the skin. So the traditional problems of any skin irritation is completely gone and the machine is completely hidden. The processor which picks the sound from the outside is actually picks it at the ear level, but it transmits through the waves through the skin to the actual device which is under the skin. So this gives the hearing back and gives them a completely normal hearing. And it goes through the bone and the sound quality is amazingly normal. And we have children, adults who can hear music as clearly as possible. So this is how the sound can be transmitted through a device called a bone bridge. There are conditions where a hearing aid gives a wonderful hearing, unfortunately, but there are certain conditions where we cannot wear a hearing aid. So if the hearing crosses certain level and then we need a very louder and louder hearing aid, obviously we expect some distortion in the sound. There can be an echo because it vibrates in the ear. It can be a little bit loud, and the brain always compares with the other side, which has a very clear, very sensitive hearing. So expectedly, we cannot be forcing a little weak nerve with an extremely loud sound. So the quality of a sound through the bone conduction can actually be very, very good. So a bone conduction has superiority when it comes to certain amounts of deafness, especially if it's the disparity is too high. We are actually recruiting the hearing from the other side. For example, people with single-sided deafness, and if they don't want to go for a cochlear implant, cannot afford an implant, or for various reasons are not suitable, a bone conduction device is extremely good. So a bone bridge, we have a lot of experience in people with single-sided deafness, where we have implanted this onto the ear which does not hear, and they're able to transmit the sound with almost no loss to the other ear. They pick up the sound from the ear which is weak to the other side, and they're having amazing hearing. The quality is extremely good. It's nowhere comparable to a weak or a very, very loud air conduction sound. So this is a life changer for them. They're able to hear almost instantly with a very natural sound. I have a lot of experience in bone bridge cases. We have several children with very abnormal anatomy. We see the outside bit where the ear is not formed, but the complexity is very, very high. So they can have a no pinna on the outside, but a normal ear. At the same time, they may look normal from outside, but the canal is not formed. The ear canal is not just a tube, it develops with several bones forming and things. So the mastoid process may not be normal, the joints may not be in a normal place, the facial nerve comes out in a normal place, the inside anatomy may be altered, the jaw can also be smaller. So finding a right spot to secure is extremely challenging. So we have a wonderful way to take the scan and plan this with an auto plan well ahead of before we open the ear. We can also plan in future how the ear reconstruction can be. So a auto plan is an extremely useful tool which tells us exactly where the implant can be sitting. Equally so, if the ear has certain other abnormal features like large sinuses or very thin bone, the screws where they sit, how close they are to structures can be easily planned before, well ahead. There's also the beauty of the device is it is secured in two places with the screws, and the screws are the active screws which actually work. So that gives a big advantage of how stable the implant is inside the bone well which is created. Also the way the transition is so flexible that on any difficult ear we can still suit it to the contours of the skull, so nothing sticks out. So that gives a almost normal feeling from the outside. We want it to be shallow, we want it to be easily accessible for the processor, for the receiver to fit in with the thinnest or the easiest magnet. But the aim of not having something which is prominent, feelable, is an amazing balance which can be fit with a bone bridge. It's completely flexible, mobile, and very accommodating to different various skulls. Adult ears which have or big children who have infections and there is a mastoid cavity which cannot put it in the conventional place, still there is a lot of flexibility that the implant can be fitted, the active screws can be fitted at a remote distance, but still the receiver sits in an absolutely normal place, and the conduction to the bone is actually very good. So there is very little amount of distortion or change compared to the normal side on the other side. So that's a big advantage of the bone bridge.